Good evening, all. We're going to officially start the meeting because it's just 6 o'clock. So first of all, I would like to welcome you all to this meeting. This is the last meeting of the municipal year. So I'm really excited, and I would like to thank you all for attendance throughout the year and all your hard work and collaboration. So first of all, I'm just going to go through a number of administrative items. So first of all, just to advise you that in the event of a fire alarm, everyone should immediately leave the building through the nearest door and assemble in the car park near Clarence's house. For anyone here who would like to use the Wi-Fi, password is Dream, Shine, and Level, all lowercase. The first item, we have apologies for absence, and we have received apologies from Councillor Simon Shelley, but we have Councillor Jane Rubari, who is deputising on his behalf, so thank you very much for coming. We have a few members of the committee who are joining online. We have Councillor Marian Lecoy-Green, then we have Nigel Green, who is our parent county representative, and also Councillor Dr. Meg Blanche. So welcome you online. I'll try my best to make sure I monitor the screen, so I give you the word when you put your hands up. The next item, we have declarations of interest. So I would like to remind members to declare any known interest in any matter that will be discussed this evening. Councillor Chandler?
Yes, in respect to agenda item 8, I am involved in consultancy work for social care companies, and I note the prioritisation document does mention co-production partners. So that's a personal but non-prejudicial interest.
Thank you. Councillor Perry?
It's just a standard one for me that I work for New College Swindon. Thank you.
Thank you for declaring the each one. Anyone else? Councillor Howard?
Just that my daughter works for social services in Swindon.
Thank you. Councillor Fernandez?
I've got the body image.
Thank you very much. Councillor Lodge?
As ever, I'm a governor at the United Learning Trust and also at Even Swindon Primary School.
You, we will know that. And Councillor Lecoy-Greeny?
Same for me as usual. I work for Oxford Health NHS Foundation Trust.
Thank you very much. Brilliant. So we can move to the next item. We have minutes to confirm accuracy of minutes that were took of the meeting that took place on 10th of April. Are the committee members happy to accept the minutes as a true record?
Yes.
Anybody against? So we'll accept the minutes. Thank you very much. This means we can move to the public question time. In each meeting, we allocate about 15 minutes for public questions. Are there any members of the public who would like to ask questions? No. So this means we can move to the next item, and we have right care, right person briefing. And I believe that Mr. Gordon, who has joined us online, who would like to present the report. Can I hand over to you?
Thank you, Chair. Much appreciated. I will take the paper as read, and it's quite a brief paper, and that should be taken as a reflection of just how well the rollout of this particular program has gone. We are just over a year since we launched Care Right Person in partnership with Wiltshire Police. Obviously, we cover 2 police forces across the geography, but the force that covers Swindon is Wiltshire, but we have worked as well with Avon and Somerset Police in implementing this, and the mental health provider, AWP, covers both police forces. So the paper goes through the phases that we sort of approach the program with, starting with the welfare concerns element, concerns for safety, and then moving on to phase 2, which was medical incidences and the 136 element. And we set up a 2-tier governance approach to this, which one was tactical, the other was strategic, and also put in place an escalation process that we, as the commissioners, were supporting, just to make sure that any learning that could be captured from incidences that were coming through could be captured. And there is also some data in the report, just to give a flavour of what we've seen so far. And just to note that on section 4.2, where we're looking at the SWAST activity, there hasn't been the demand on SWAST is a BSW-wide issue. It's not related specifically to this particular piece of work. We do have mental health ambulances within our system, and that's to do with parity of esteem. So the responses within that haven't noted any significant increase with regards to this program. And what else is there to mention? And also the CYP, so the children and young people element of this went live on the 8th of Jan, and so far no issues or concerns. It's easy to listen to all that and think, oh, this has been a pretty straightforward piece of work. It hasn't. I must mention that this program came at a time of very, very strong relationships between the police and partners. And I must mention Dave Minty from Wiltshire Police, who throughout this whole period has shown extraordinary leadership in navigating what has been something very, very complex. So the partnership arrangements had already been established through things like the Crisis Concord Act work in mental health. So, things like the MOUs for what the police do when somebody walks out of GWH, those were already in place. Working arrangements between AWP and the police with regards to people that are detained under 136, people that go AWOL, those were already in place. And working arrangements between the system and the ambulance service, those were in place as well. Although that last bit had to be worked on a little bit. But those relationships, I think, really put us in good stead. And that the biggest difference between Wiltshire Police and the rest of the police forces, I say the rest, I say some of those in London, who basically took a different approach, which was to, we're going to drop the baby, we're not doing it anymore. Wiltshire Police took a very different approach with us, which was, we want to work in partnership, we want to work in collaboration, and build on the work that we've already done. And they worked with us in collaboration to mitigate any risks that we had. So it was a very structured, well-managed program, or certainly has been to date. So I just wanted to flag that there's been a lot of work that's gone on behind the scenes here, not just through this program, but beforehand, and a lot of partners who have gone above and beyond in terms of being flexible, working to very tight deadlines, and being accommodating as well in all cases, to ensure that this has been a smooth transition and people are kept safe.
Thank you very much for that opening. Before I open the discussion, I'll start with a bit high-level question, because you mentioned very strong partnership and a good relationship, which I'm very pleased to hear. It just struck me that the MOU, that is kind of like, it forms the fundamental protocol that you all work towards to, but actually it wasn't signed in time for the program to go live. So how come, if there's such a strong relationship, the MOU wasn't signed in time?
Yeah.
Delays.
I think that.
To go live without the MOU in place.
Yeah, so it's two parts. So I think what you're flagging is something I mentioned in my narrative about the SWAST and the transition. So there were particular elements of the MOU that SWAST weren't particularly happy with, although all the other partners, so the local authority, AWP, GWH, and the police, were all comfortable and happy with those. So there had to be some, I guess, some additional work to just agree those bits, but they weren't material in stopping the work going forward, because they were existing arrangements that were in place that could carry on. So to answer your question, how do you carry on without an MOU? it's because you already have arrangements in place already that you've been working to. What you're trying to do here is set something new up. But of course, even before you agree that whatever you've got in place still stands. So that's where the difficulty came, Councillor, if I'm honest, was the SWAST.
So could you maybe please elaborate on those issues with SWAST?
I think it was from just recollection from memory. I think it was to do with specific circumstances where they felt it was inappropriate for a paramedic to be involved or to be part of the response. I think sometimes where you have patients say somebody's in the street in the high street in Swindon, and they're not known to services, and someone is concerned for their welfare or safety. Often when the call goes in to the blue light services, it's an ambulance and police response. And the ambulance services have always been pretty flexible in that. But their view is, look, if someone doesn't need a medical response from us, then we just need to get a bit tighter at screening that out and saying, actually, it's not. Whereas the partners would say, well, actually, it makes sense for both of us to turn up to the scene because, if someone does need a medical response, then it just means we don't have to then call and do another call for an ambulance to come out, and doesn't put the police in a situation where they have to perhaps try and manage a medical situation. They do have training, of course, but not to that level. So during this process, SWAST took a very strong view about, those circumstances where paramedics would be involved or not. But that's on a backdrop of significant ambulance delays. So I'm just seeing it from their perspective to say, look, they've got ambulance crews that are very pressed, queuing up outside GWH. People are calling ambulances at home with, who are very sick. And as far as they're concerned, they have to start looking at these cases and thinking, no, we're not turning up unless it is a proper medical emergency.
Thank you. Thank you for answering that. I'm going to open discussion. Are there any questions from the committee members? Councillor Davies?
I'm looking at the lead agency matrix, which basically says, if there's an unknown location, then it's police, and otherwise, then the ambulance might get involved. Are there situations in which the ambulance wouldn't attend? Like, if it's flagged as ambulance, bearing in mind those difficulties that the ambulance service is having, do you have any feeling? Not necessarily the percentage on the top of your head, but how many of those don't get attended by ambulances? Like if it's flagged as an ambulance case.
Oh, got you.
Ambulance always attend, I suppose is the question.
No, I think that's the point I'm making out there. I can't give you an actual percentage, but I think what they do now is they apply a bit more scrutiny to the call for an ambulance. So previously it was kind of, it's worked on the basis of the person calling that an ambulance is required to be at the scene. Now sometimes ambulance paramedics turn up and maybe someone has self-harmed and actually it's appropriate for them to be there. But even sometimes when somebody has self-harmed, it's not severe enough for a paramedic response. The police and mental health staff are trained to undertake minor care for people who have self-harmed. And then, if required, they can go into a minor injuries unit or something like that. So I think what's happened here is that they're just not turning up when they don't need to, as opposed to not turning up when they do.
Thanks. So on that table where it says that it's an ambulance response, does that mean that it's police and ambulance, or are there situations? But there are some situations where police won't attend, but the ambulance will. Is that right?
Yeah. I mean, sometimes there is no need for a police response, and that's part of the tension of the MOU stuff is actually who is most appropriate to attend a specific situation. It's not always both. And the police, obviously, through the right care, right person, clearly take a view in some cases that, well, we won't attend unless the police need to be there. And clearly the ambulance would take a similar view, which was always the anxiety at the start of this council. When all this started, people were really worried that what would happen is we would have a flurry of cases where we would have health professionals and social care turning up, and the police and or the blue light services both saying none of our business. But that hasn't happened. In most cases, it's been a good call and the right call.
Yeah, I think that last sentence is what I was getting at. So if the police say that it's not for them to attend, it's for the ambulance, and then the ambulance do recognise that it's for them to attend, but they haven't got the capacity, that would be my concern.
Indeed. And I think that's where we've got the escalation process as well. So in the early stages, Councillor, we did have a number of cases, I say very early, within the first few weeks, and we were using those as real-time learning events. So my recollection, there might have been about 3 or 4 cases that we as multi-agency partners kind of followed through to say, well, what happened here? What was the outcome? Why didn't you think it was appropriate to attend, and what can we learn from that? And sometimes it might just be something as simple as, at the point at which the person was making the call, they missed out a specific bit of information that they didn't think was important, but actually is quite relevant. So all of that learning was captured very early on, and we never got the same rate or level of escalations. What happens in most cases is people sort it out quite quickly because it's something that's now quite well rehearsed on the ground anyway.
Okay, thank you.
Thank you. I would just like to follow up on that. I'm not really sure if you actually answered what Councillor Davies was trying to get to, is if there's a call and then the police are going to do it, but it's supposed to be ambulance services and they literally have nobody who could attend. So what would happen in those situations?
Give me an example, Councillor, just to bring it to life a bit. So are you talking about a life-threatening issue for a patient?
So, for example, let's say that it's severe, for example, self-harm.
Yeah. Okay. So if it's a severe self-harm case, it's obviously triaged through the normal 999 scale, right? So category 1, 2, or 3. So mental health patients are not treated differently. If it's a severe self-harm case, then the person is triaged in the same way. Now, at that point, the ambulance service would be using their own policies and procedures to prioritize between that and, say, a stroke or a heart attack, or anything else that was on their call stack, if that makes sense. Do you see what I mean? So once an incident reaches a threshold of this is a category 1 response, and category 1 would be life-threatening. They'll have on their call stack a number of other life-threatening conditions. There's an RTA on the M4. My mum's having a stroke. Gordon's having a heart attack in McDonald's, and do you know what I mean? So that would come into that category and would move out of what would be an RCP kind of response. So here we're talking really about non-life-threatening incidences where paramedics have been called to the scene and one hasn't always been required.
Thank you very much for that clarification. Councillor Lecoy-Greeny.
Thanks very much, Gordon. I just to kind of name it, I am a mental health professional and I do work for Oxford Health NHS Foundation Trust. So
yes.
I've named that already, so I hope it's okay. So I just had a few questions in terms of, I know that BSW operate their kind of out of hours mental health helpline, which probably absorbs quite a bit of the CYP side of mental health crises away from, say, 999 services. And I just wondered if there was a sense of how that changes the CYP kind of after 11 o'clock at night when that helpline shuts down and it does go into 999 and 111 services. And I just wondered, I know that there is no known patient harm, but I still get a sense that there are unresolved gaps in some of the pathways. And obviously everything does get triaged in the same way for physical and mental health, and that's quite difficult.
Yeah.
Although no harm may have happened, there's a lot of impulsivity, especially with CYP, and there's lots of maybe non-disclosure of how severe the harm is unless they're responsible adults with them. So I don't know if that's not a massively clear question. I just wondered if there was a sense of, is there more data on the kind of when these calls come in, the times around when they come in, and whether that, I suppose what I'm thinking about is there scope for extending the helpline if there is a known uptick once that helpline's shut down, if that makes sense.
Yeah, so are you talking about over and above NHS 1112? Because
So
obviously,
the BSW mental health teams for CYP, they have their own in-house helpline where anyone, so obviously this is anyone open to CAMS, but obviously we do triage other young people who aren't open to CAMS. So I suppose actually that's now kind of another question, which is, do we have a sense of how many of the young people presenting via this pathway are open to CAMS?
Oh, right, got you. No, I don't have the answer to that, but I could find out, Councillor.
Yeah, that might be handy. And then, and I just wondered the impact of the helplines on reducing patient flow through the 111 and 999 pathways.
Yeah, no, got you. Okay, I mean, I think that is data we've got, but not data that's not covered in this report. But it is a good question, because some of it obviously will come through our newly launched 1112 offer, but also the mental health ambulance pathway. And obviously, what we know from Oxford Health is that the in hours offer, or the offers that are available, are very robust. And what we see more of actually is the non-mental health crisis of children, young people. So those that are in care facilities and social care that have broken down, etc., who end up in paediatric, which often fall outside of this pathway. But yeah, I can get that data.
That'd be handy. Thanks very much.
Thank you. Take it away as an action for the information to be provided, if that's okay, Gordon.
Yeah, of course, no problem.
Thank you very much.
Bob,
Councillor Perry?
Mine's just a quick one. On 3.8, the 97 missing persons, I just wondered if there was a positive outcome for them. Were they all found safe and well?
Hang on a second. I'm just trying to go to where are you looking, Councillor?
Page 7 on our paperwork. But it's actually the 3rd page of your report.
Right. Okay. Got ya. Oh yes, you're talking about the is it the GWH cases?
Yes. Yeah.
Yes. No, I spoke to George, our director, today about those, and yes, they were. There weren't any untoward incidences related to those.
Lovely. Thank you very much.
Councillor Chairman?
Thank you for the report, Gordon. Probably one question with a potential follow-up. Can you sort of outline how the different safeguarding risks are assessed differently with regards to CYPs versus adult patients?
Yeah, I mean, obviously, from a children and young people perspective, you've got to play in the MASH as well, the sort of multi-agency hub. I guess some of that depends on location, Councillor. So obviously, a young person out of hours, and they're very, very small numbers, which is why I was saying to Councillor Marianne, there will need to dig some of those out. It would be really unusual for a young person to be presenting on their own somewhere out of hours in that way. But obviously, wherever a young person presents under any circumstances, then there is always a caution given to ensuring that the right services present. I don't think there was ever any shall I say, debate amongst any agencies in the lead up to this around children and young people. I think it was always mainly around adults. So yeah.
Okay, so
Gets,
that's if I'm understanding you right, then can you go into a little bit more detail about sort of how patient outcomes have tracked post incident through the RCRP? Obviously, I'm looking particularly at this in relation to children and young people, but it sounds like that process is fairly well secretized.
yeah.
But it isn't necessarily for adults. So can you go into a bit more detail about?
Yeah, so I think it is robust for both. So let's take children for a start. So the agency that if it's a child that is known either to social care or CAMS, the data will be held. The bulk of the data will be held within that agency. The police obviously hold their own data, and so do the ambulance service. So we do have the mechanism of bringing that information together. And sometimes, if it's a vulnerable child who's known from a safeguarding perspective, MASH will have that as well. So the governance systems that we have within place, such as the partnership boards, etc., will be able to triangulate all of that information. Same goes for adults as well. So the only time where none of those agencies would have any information would be if it's a young person or an adult that is completely unknown to the service. And in which case, whichever agency presents, if they do end up being admitted or whatever, would convene the record. But most of these cases, counsel, are unknown to services and will have comprehensive records attached to them.
Appreciate that, and thank you very much.
Thank you. Any other questions? No. So I'll ask one more question. In the report, you also mentioned that there were some cases of conscious escalation where it was neither police nor ambulance services who were the right service to respond.
Yeah.
And you were taking steps to find the right agency.
Yeah.
Has there been any outcome on this yet?
Yeah, that's a good question, Councillor. So what we're talking about here is unmet need, essentially. So these are uncommissioned services. So there's a cohort of people that sometimes don't need any of the services that we provide necessarily, but they need something, and that something isn't always available. So they don't come to any harm, by the way. We're not talking about people come to harm as a consequence, but we're talking about people that are revolving. Apologies for the term; it's probably not the right word to be using, but they're multiple users or they have multiple touch points across multiple services. So they're small numbers but high usage patients, and some of those will go to A&E several times as well, where perhaps they don't need to be in A&E, and the A&E staff know who they are, and they'll get discharged. They'll often go to their GP surgery as well several times, and some of these people will also be high users of blue light services, so they might call the ambulance and police service when it's not required. It's that cohort of patients where there isn't a specific need, but it's debatable whether one is required in addition to what's already being provided through other agencies.
Thank you for clarification. Okay. So wouldn't it be maybe possible to look how we can prevent them from actually, reaching out instead of, having this consideration if there's more commissioning for this sort of unmet need?
Yeah, so so some of those pieces of work have been done from an A&E perspective, Councillor, where there've been projects to look at high intensity users of services and looking at some of the reasons for it. But you're right, more can and should be done in that area. I don't think that we have a very good I say strategic lens on that particular cohort of people across Swindon, or particularly clear either what, because it's not like they all need the same thing. If you get what I'm saying, they're quite bespoke things. So they're not the kind of things that you can sort of cohort and say we will commission something like this. They're often really bespoke interventions. But in all those cases, I think there's always an opportunity to stop them escalating, no doubt about that. And where we do identify them, we put care plans around them between agencies to ensure that actually they don't keep going to their surgery or their to A&E or whatever. But it's on an individual basis rather than a cohort.
Thank you. I'm going to go to Councillor Davies.
Yeah, thank you, Chair, for bringing up that section. It's a really important one. I had this conversation at the weekend with a priest who basically fills in this gap, and that's in terms of third sector. It's probably not one for you to answer, but it might be one for this committee to take up in future as to what do we do with the gap in provision between, if there is, at the weekend, if people don't have anywhere to go, where do they go? So there might be an answer, but I don't know.
Yeah, Councillor, it's a really good point because I mean, there is a lot to be said for providing meaningful social activities for people, things for, something for somebody to do. It's positive for their physical health, positive for their mental health, and that positive social interaction is really good as well. And from a young person's perspective, many of us who are old enough will remember and talk about it in the context of things like youth clubs and stuff like that, where you didn't have young kids roaming around the street looking for something to do, and most of the time that something to do is harmful either to themselves or others. And so those kind of facilities did a lot, not just in terms of giving young people a hub that they could be together, but they did protect them in other ways. So it's a similar sort of thing, isn't it, around that something that that people need, and it is definitely something we need to think about.
Thank you. Councillor Coyle-Green.
Sorry, it was just to lean in a bit. I just wondered, and I think the answer may be no, but I wondered if it's available, some kind of wider demographic data around those kind of revolving door, I don't like that term, can't think of anything better.
Yeah.
That are, multiple, eliciting care, they're clearly in need, but I wonder if is there kind of wider demographic data about gender, kind of race and that kind of, or any kind of common threads that could actually result in some more robust signposting. Is that data available? Does it exist?
Yes, it is. Our population, we've got a very, very whizzy population health data chap in the ICB who was showing me this data at neighborhood level. It was quite raw, but he was able to drill down to that level. So not just things like age, ethnicity, other characteristics, but he was able to drill down into what wards are they coming from, and other characteristics. So that data is available, and it has been used to set up bespoke interventions, particularly through general practice sometimes where we've needed to manage demand.
Thank you.
Thank you. Would it be possible for you, Gordon, to share the data with us?
Yes, I how would you like it, Councillor? Would you like it just sent to you, or would you like me to come back and speak to it?
Well, I was sort of thinking if you could send it to us, and then maybe if we could have a follow-up item where we then could look into those bespoke solutions and how effective they are actually preventing these high-frequency users from using the service. I think that would be quite an interesting item for the future.
Yeah, absolutely. I think what we're good at is understanding high frequency users of a specific service at a specific time. So we'll tend to focus on, say, emergency department. I think what we're not so good at is understanding that at a more city Swindon level. So you might have people that are not just using ED, but when they're not using ED, they're attending their GP quite a lot, and when they're not in their GP, they're making contact with adult social care, and when they're not with adult social, do you know what I mean? I think it's how do we get that rounded data for those cohorts of people. We already know, for example, that some of our areas in Swindon have a much higher walk-in rate to ED, and that's not just about proximity. Proximity is one of those things, but there are other characteristics about the demographics who are living in and around the area of GWH that are presenting significantly higher than other populations within Swindon. So yes, there's we can definitely share it.
Yeah, thank you. I think it would be an interesting area to unpick. I'm going to go to Councillor Perry.
It was the same question.
Okay, perfect. So covered. Councillor Coyd-Green, is it an old hand or is it a new hand?
Sorry,
Okay.
no.
That's fine. Any other questions? No, perfect. So I would close this item. So I think when it comes to right care, right person, I think we can be to a certain extent satisfied with the rollout of the program. There are obviously still issues like unmet need that we can look into more detail in one of the upcoming sessions. But unless there are any other suggestions from the committee members, I think we could close right care, right person. Yeah, we're all in agreement.
Yeah.
So what we'll do, if you send us the data, Gordon, and then I would liaise with you through committee services to bring you in one of the upcoming sessions for the next year, if that's okay with you.
Okay, that's great. Thank you.
And thank you so much. Thank you so much.
Bye-bye.
I know it was last minute, so thank you so much. Appreciate that.
Thank you. Bye-bye.
Thank you. Bye. Thank you. So we can officially move to the next item, where we have Swindon Send an alternative provision improvement plan readiness for the inspection by Ofsted and the Clear Quality Commission of the effectiveness of local area send partnership arrangements. So I would like to invite Councillor Dixon and Nicola Compton to introduce the item. And Councillor
Firstly, can I just take the opportunity to congratulate you again, Chair, on your marriage. And it's been great to see you return back, not just a smile on your face, but a ring on your finger. So wishing you all the best. And I'll have to also take some time just to apologise for some typos on the report. As you would have seen, there has been structural changes and new appointments. So if there are any typos, they were, if they can be omitted and if a note can be made, please. I will be introducing the report today with Nicola, who's here present, who has a presentation as well. And Nicola will be sharing no doubt seeking information in today's discussion. Thank you.
Thank you.
Good evening, everybody. I'm Nicola Compton. I am newly appointed Head of Send and Inclusion. I've been in the role 4 whole days, so please bear with me. So I put together a little presentation that's up there. Obviously, the report, the very detailed report, was written by my colleague Annette Watson-Ross. So I want to make sure that she has the credit for the details that she's put in there. I've tried to simplify it, but to make it shorter for this conversation. So obviously, the focus of this report, with regard to this first slide, the purpose of this report is to basically update you on how ready we are for our Send local area inspection and how that fits in with the DFE's Send an alternative provision improvement plan. So basically where we are. The document that you've had summarises our current situation and the background in Swindon for Send, and it focuses on how we can improve our journey for children and young people at Send. The key goals in the report are to improve co-production with our partners, which will be our families and our young people, partnership working with health and social care, and making sure that we can give innovative solutions to ensure better outcomes for our children and young people at Send. So, when the inspectors come, what will they be looking for? They will look for 5 key areas. These are the 5 key areas that come from the DFE Send an Improvement Plan. They're listed, they're listed here, and you will see in the report there's information provided in each area in detail about where we are with those reports. So I don't intend to go through that line by line, so I'm sure there'll be questions about that. The other query is around the information we need to provide. We have something called an Annex A, which is an incredibly detailed long list of information that needs to be provided and a whole data set. And we're working on that now. It's one of those jobs that's continual because you're constantly updating your documents. So we're making sure that they're as up to date as possible, making sure that we are co-producing them with our families. I wanted to highlight some key things from the report. Firstly, some stats about Swindon. We have approximately 15% of our children receiving additional SEND support, and at the end of 23-24, 6% of our pupils have an EHCP, which is higher than the national average and quite a bit higher than the national average. What we're looking at to support our young people is making sure that we have multi-agency audits for EHCPs. These are to ensure that each EHCP is of good quality and that children's needs are clearly identified and that we're making sure the provision meets those needs. We're looking at making sure that we have earlier identification and intervention. I particularly wanted to highlight the PIN project, which is the Partnerships of Neurodiversities in Schools. I wanted to highlight that to you. Another very key area, and these two actually link, is that we've prepared an adult protocol to support transition and really focusing on making sure that our young people are supported to move into employment at the end of their education journey, with a real focus on supported internships. Something that I really needed to highlight is to ensure that all our children get the right help at the right time. There has been significant funding put in place to provide additional resources as our young people need some more specialist provision. This includes 4 SEND units in mainstream schools, the expansion of our existing special schools, and creating a complex secondary SEND unit. And these are to come along online in year 25-26, that's an academic year. So that's a very big increase in provision for that year. What mustn't be forgotten is how we did look at all these changes, how we look at our inspection moving towards those targets in a co-produced way. We're exceptionally lucky in the fact that we have the Swindon SEND Family Voice, which are very proactive in supporting the council and advocating on behalf of families. We also have the Steps charity that makes sure that the voice of our young people are heard, and it's crucial to the development of not only any policies we do, but preparing for the inspection. And we have established young people's champions to make sure their voice is very much at the fore. We're continually trying to work to increase our partnership working with health and social care, as it's not purely, it's an education, health and care plan, and each part of that is equal to not merely an education plan. To ensure this, leadership in the council are committed to improving our SEND services through regular multi-agency meetings and strategic oversight. We continue looking at ways to improve, and that includes ensuring that we have external reviews and audits, and we have a local government peer review coming up in June to actually deep dive into our provision and to make sure that we are being challenged on what we're providing so we can move things forward for our young people. And most importantly, that we're inclusive in our decision making, that we're engaging with our children and young people and their families to make sure their voices are heard and considered in our service planning and delivery. So that was just my highlighted tour, but I'm sure there's going to be lots of questions. So that's what I'm going to suggest we go on to next.
Thank you very much and welcome to the council. Thank you. I'm going to open the debate. Councillor Davies?
Yeah, congratulations. Are you Swindon Borough Council before? Or
No, I come from another local authority.
excellent. Well, I expect full and complete answers. Yes, if we could go back a few slides, I suppose it's these 5 sort of priority areas. And again, so completely unfair question, completely realise that. But there was lots of detail in the report.
Yeah.
Are you able to give a sort of RAG status of those 5, and sort of a summary of, so are we, you know, how ready are we in those 5 situations? Because I wasn't able to distill the stats in the report into a tick cross type thing. Is that, or is that?
I think that's tricky. They're very subjective statements.
Yeah.
So it's very hard to say exactly where we would be percentage-wise on them. What I would say is an absolute strength is that we do identify needs accurately. You know, the EHCs are clear. We're change programme leads. We're working with the DFE to make sure that we have the best possible template for our young people, so their needs are identified accurately and clearly. So I would say that is a strength. We do have a difficulty in the fact that currently timeliness would be an issue. That would be, if parents were speaking, they would say the timeliness of some medical assessments, I'm particularly thinking of diagnosis assessments, is longer. It's not as long as a lot of areas, but it's still not ideal by any means. And equally, because we've had a huge increase in requests for EHCPs, that has impacted our EPs. We obviously have to do a report for each assessment, and that has significantly affected our ability to complete EHCs on time. So if you're asking me to evaluate that, the timeliness would be where I would say that we've got a concern on that. Well, is that how much you're going for the, I'm still on the first. So accurate, but good on.
Okay.
Timeliness,
Yeah.
not so much. But would I say it's effective? Again, I would say the plans, when they're completed, are effective. And we're looking very much at our evaluation of our EHC plans to make sure they're an effective document that can move children's needs forwards. Right. Participating in decision-making about their individual plans and support. This is always a difficult one, if I'm really honest with you. We have just completed an annual review survey and we're getting that data. We are improving on that, so I'd probably give it an amber if I'm giving it a rag rating, because we are showing improvement. It's an area we always need to work on, because the feedback you get from families is always they want to be at the very centre. There's always more we can do. So I wouldn't say, I wouldn't be giving us a green, but I would say we're making good progress on that. Children and young people receive the right help at the right time. In the same survey, professionals said that they were confident about this at a high level, and I think approximately was around the 70% mark. So I think we're really getting there on that. We do have a national an issue like the national population of making sure that we have enough specialist placements and meeting need quickly. With the new provision that we're putting in place, I would hope that, again, I don't want to be brave and say it's all green, but I'd say we're moving towards that. We're putting a lot of support in there. It's always an area that we need to work on in development. And I know I seem like I'm saying everything's a work in process. That is the situation with SEND. We constantly do need to improve. Children and young people are valued and visible and included in the community. That's probably not one that I would feel confident on 4 days, being 100% confident that I can answer that to you, but I can find some more data and bring it back to you if that's what you'd like.
Thank you. That's very impressive. Given 4 days. So I feel like we've asked this question before because we have. I think we've talked about this before, but why are there more EHCPs in Swindon than nationally? You know?
That's always a hard question to answer. It can be parental choice because obviously part of that is parental confidence. Are they looking for an EHC to secure and be clear that their young person is going to have the support they need? And it might be that we need to build confidence that our schools are going to meet their needs prior to an EHCP and that an EHC may not be necessary. I think what we have noticed in the figures, when you dive a little bit deeper, we've had a smaller increase in numbers of EHCs than other local authorities. We have had a higher starting point. So a number of local authorities used to delegate more of their budgets, so had a much lower starting point of increase, whereas our increase has been less, but we do have a higher proportion of young people. To be honest with you, I would need to do more investigation because it could be factors like what we need to look at is our percentage of each individual need. Are we seeing that we have a higher level of young people with SEMH in our area or ASD? Is there a particular factor around that we need to put more support in? But I'm going to apologise that I'm not quite there after 4 days.
And do you mind I just bring in Councillor Shea because I think
Thank you. I just wanted to add to that, Councillor Davies. 3.26. There's just a reference there about a pie chart number there. So 60% of requests for assessments actually come from the education setting, and 20% comes from the parents or the carers. Now, going for an EHCP isn't always the first port of call that we'd like, and I just thought I'd mention that today. There are early intervention support that can be accessed. Having an EHCP doesn't always mean that the child will get the same level of support. It is the outcome of that EHCP that determines the diagnosis, obviously, and the support in place to support that child for the rest of their young life. But it does start from early intervention. And what we're seeing within is safe nurses, the uptake and the understanding of the benefits and the outcomes of that does also sit with the responsibility of the 60% of the education settings that should be advocating for more early intervention support. Just to highlight that. Thank you.
Thank you, that was very useful. Back to you, Councillor Lewis.
Yeah, just a very quick one. Do we know when Ofsted are coming?
Well, I wish I had that magic, but unfortunately that's entirely in Ofsted's hands.
Thank you, Chair.
Thank you. Councillor Chin.
Firstly, congratulations, Chair. I'll have to get you a card. Welcome to the council, and thank you both for the report. The multi-agency SEND sufficiency forum, which I think is covered in section 7. Can you tell us a little bit more about that? Specifically, I'm looking for the constituent members and how frequency they evaluate outcomes. Are we looking at these findings in isolation, or is it a continuous process that's fed into the council regularly?
I'm sorry, that isn't something that I've got to hand, so I would need to come back to you.
Okay.
I do apologise.
Sorry, I do appreciate the 4 days.
I wouldn't want to mislead you and give you an answer that's incorrect.
Okay, maybe if we take that away.
Yeah,
as
we'll take it.
as
I'm
a
happy to
section.
do that.
Second, again, bearing in mind the 4 days, and I don't want to be too dismissive of the report because it is a fundamentally very well structured and detailed report. But I was a little surprised to not see home to school transport mentioned as part of our SEND offer. We know that Ofsted will inspect that as part of our statutory obligation for under 16s. So is there a reason why it's not covered in the report, and was that potentially an oversight?
It wouldn't usually be a separate part to the Ofsted report. It would actually, Ofsted will be looking in those key areas that were highlighted. Obviously, if there are concerns about home to school transport and how those young people are engaging in education, Ofsted can actually look at that. It's very unusual for it to be the main focus.
But if this council were to be having its own public consultation with parents over 16-year-olds about cutting that transport, it could potentially be quite significant to our SEND offer. I just think it might be, in terms of being a bit more proactive and upfront about it, it should be something that we should confront as a council. And I was a little surprised it wasn't in the report.
Do you want to come in?
Yeah, hi, Kirsten Nelson. So I'm in the room as Corporate Director for Prevention and Communities and similar to Nicola, Education and SEND has just moved into my portfolio. I think probably one of the things I want to put in the room is in relation to post-16. Obviously, there are lots of things that are going on nationally around SEND and access to transport. The way that Ofsted will look, when they inspect us, they'll look at the sufficiency of provision and access to provision, and it will be the fallout of that that could cause questions around transport. So they won't go in with a specific focus on transport unless there's deemed to be an offer.
Thank you.
Councillor Clay?
Thank you, Chair.
Sorry, Chair.
Apologies. No, that's okay.
No, I've got 3 questions.
I just wanted to add, I know the discussion for the 16 was very much welcome to be brought back by yourselves. The results haven't completely been analysed based on some movement nationally. So I guess that piece, once it is completely ready, we will be able to share a little bit more from you in terms of further details.
Thank you.
Hi, and welcome. Do we know how many children are currently on the waiting list for assessment for an EHCP?
I can tell you how many young people are waiting for an EP report. There isn't a waiting list for an EHC assessment as such, because obviously we are legally obligated to make a decision within 6 weeks. But there are 142 children currently on the waiting list for the EP part. They will have the EP assessment but there is an awaiting period at this point.
Apologies in my incorrect wording. Of the children and people who have an EHCP now, do we know how many of them are having their needs met successfully? Sorry about the full name.
That is a very good question. It's how that would be measured. So effectively, there isn't a set criteria to measure that success. The way we would look at that would be the annual survey from parents and young people about how they felt it was met and impressions. What you could do at some point is have criteria against your annual reviews to see what progress the young person is making, and then see if you're deeming that to be successful. But again, there's a lot of factors to that, so it's not. There isn't an immediate scale that I can say, yes, it's 70% are successful in that way.
That's kind of what I'm getting at, really. I mean, I've sat in quite a number of annual reviews where professionals in the room and parents have felt that that child has not been in the right placement and hasn't been for it quite a considerable amount of time. So the parents, for example, have felt that EHCP is not doing the child the justice that it should be. So it's really, I guess, about the effectiveness of the EHCPs, if that could be measured somehow.
Councillor Sheikh, you want to go?
That's a very good point, Councillor Curry, and like Nicola alluded to in the report, there's an audit of the EHCPs, where
It's just what I was going to say.
There is an audit that is checked independently to see exactly that and to put measures in place to be able to try and see where those gaps are. But the EHCP has to happen annually. And I know there are some parents who sometimes don't realise that they can challenge it. They don't need to wait until the annual review, but they should be having those open conversations about their child, either in the setting that they are in mainstream school or in special settings. But that conversation doesn't need to wait at that annual review.
So when that audit, do you know when that audit is due to take place?
So we actually have a team of auditors currently who are going through EHC plans. So I believe, I hope the number is correct, there's one senior auditor and 5 auditors. It's a short-term piece of work to go through young people's plans and cases to actually review and see how those young people are progressing. And also, more importantly, that piece of work is important, but then the question is, what's next?
Yes.
We have this information, what do we do?
Exactly.
Pick out those themes, and then this would then obviously go into our inspection, and also what we're going to do about it. We have this information, we realise that these are the concerns that families and people are having. How do we address that? So the auditing is happening now, and we have that data. It will be the next question, will be, what do we do about it?
Thank you, Chair. Is that something that could be brought back at some point to be followed up on?
I actually had a question on this. Speaking of auditors, because the report talks about that there's been noted some disparity in auditing. So I was just wondering if you had, obviously not because you've been 4 days, if there's any further work looking into what is causing this.
I think it's slightly different things, because they're doing 2 things. We've got a set of auditors who are auditing the case, and we also have evaluators who are evaluating the EHC. And what we do is we have a number of colleagues across the local authority, but also across health and various partners who audit EHCPs, and their bread and butter may not be EHCPs, so they're receiving training to make sure that when they're reviewing these EHCPs regularly, that they're confident about their judgments, and we're making sure that we're seeing the same judgments across all of our evaluation and monitoring of our EHC plans. The auditors are a team, so I think, I'm sorry if it wasn't quite clear enough in the report, the distinction between the 2.
Just one final question, Chair. Thank you. You mentioned earlier about looking into a breakdown of the types of need. Could that be shared with the committee once you have that data?
I'm sure, I would assume that we're absolutely happy to do that. It's obviously quite a big piece of work, so we would need some time to work on that, but absolutely happy to.
Thank you. Thank you. Thanks, Chair.
Thank you. Any other questions? Councillor Howard?
Yeah, I was going to ask that, so that's covered already, which is great. But the new provision, and I'm just wondering, are we confident that we will have enough provision? And I also wondered, what the balance is of people coming into Swindon for things and us, and how many we've got out of Swindon, must be some who's need to start in Swindon.
I'm not 100% on my figures on this. However, what I do know is that for a local authority, Swindon is quite amazing, the proportion of young people that it needs in borough. I come from another local authority and we have a very large number of children now. Swindon is managing most of their young people locally, which is amazing. They're not having to travel long distances, which is extremely distressing for them. They're not in their local community. So actually the local offer is really good. But like everything, Swindon's a growing town. So we put in provision and then we grow a little bit more and there's more and more demand. So it is something that's going to continually need to be reassessed. So that would be very
Councillor Sheikh would
Just
like to
add
add
to that
something?
point, it is very important you raise that as well. We must be mindful when we're talking about spaces and creation of spaces, children with additional needs. You've got to look at the need as opposed to finding a slot to put them in. So it's not space management, which we do have sufficiency and we have to forward plan, yes, but that child has a need and it's the need that needs to be looked at the right setting. Because you could have the case,
I guess.
but you can't predict because we are building the houses, we do need the homes, we do get we want to aspire to be a town where everyone wants to come and live and have a family, but you can't take a child and place them in a setting because there is a space. You've got to look at that child's needs and it might not be that setting that is perfect.
Thank you. Thank you. Any other questions? I also wanted to ask, in your presentation, you highlighted the partnership neurodiversity in schools projects. So I just would like to understand what impact is this project delivering and how are you measuring its
It's actually a health project, so we need to get the data from them about the impact. What it basically is around upskilling schools to meet the needs of our neurodiverse population earlier, and also most importantly, pre-diagnosis, and actually making sure that our schools are neurodiverse friendly, and lots of different things are implemented to meet the young person's needs at that very initial early identification stage. So it's really about upskilling the teachers, the TAs, so that those young people's needs are met straight away and they're comfortable and happy in school. So that's the aim of the project. So the NHS professionals go out and upskill staff.
Thank you. Yeah, that's really helpful. So would this then also help with kind of that early intervention?
Yes, the aim is that we're getting it right for that young person as soon as they go into school, not waiting for a diagnosis that might be a little bit down the line. Actually, we're spotting that young person has sensory processing needs, that they're getting a sensory diet. We're looking at what they need as soon as possible.
So at the moment it's 8 schools. So are there any plans to roll it out further?
I would hope so, but that will be a discussion with our health partners. I do know that health, this is from my previous hat, that this is a really successful programme that health are very much piloting because they're aware of the waiting lists are longer than they would like. And actually, we need to meet children's needs where they are with a diagnosis. And this is a really good way of meeting those needs for every young person. And usually what's good for a neurodiverse child is also good for a neurotypical child as well.
Thank you very much. Are there any other questions from the committee? So I would just like to maybe discuss the areas we'd like to unpick further, because I think we covered quite a bit about EHCPs and their auditing. So would it be possible to bring another item, just drilling a bit further down and understanding these themes?
Could I ask, just so that I want to make sure that the next report actually meets exactly what you want, could you be clear exactly what you'd like from me so I can make sure the report really appropriately reflects what you need? Would that be possible? If you could agree some key questions and I can make sure that I answer them, and then you're confident that you've got the information you want.
Sure. So I open it to the committee. What are the specific questions you'd like to look at?
I already mentioned them, so hopefully they're minuted.
So can we just maybe catch up after the official meeting and just agree them between the cabinet members and ourselves? Yeah, let's do it that way. So I'll close this debate. Thank you very much. And I must say it was impressive discussion. And considering you've been here only 4 days, well done. Thank you.
Lovely to meet you all.
Thank you very much. Thank you. So if committee members agree, I would now call 5-minute break, just to stretch our legs.
Yeah.
Come on,
It's just the two questions.
So we're gonna reconvene now. Yeah. And we're gonna move to the next item, which we have sufficiency of placements. So I'm gonna invite Councillor Dixon and Seth Harris-White to present this item. Thank you.
Thank you, Chair. I'm just going to run through some of the key elements of the report and invite Seth to join me in answering any questions that the committee may have. I'm just going to run through some key points. In August 2023, Council produced a sufficiency strategy, which was approved by Cabinet in October 2023. And the strategy highlighting the need for the council to increase and create local provision to meet the needs of children and young people so that we could keep them local. And this was also highlighted as one of the key areas in our Ofsted inspection in 2023. Part of this sufficiency strategy is informed by a full needs assessment of children looked after in Swindon. And then there's an action plan that is developed each year, and in the appendix to the report is a copy of the 2025 action plan. Just looking at moving on, as the report says, that section 3.1, children and young people should be cared for and have the right place in a family setting as the first preference. But it's not always possible to do that due to continued impact of past trauma or due to lack of availability of the right match of the right need. Going on, I think looking at the testament to the hard work of our team, we've been able to move children, 25 children back into Swindon, and we've had Ofsted inspections since follow-up from the original Ofsted inspection that said that we needed to do more around the sufficiency. But more recently, Ofsted noted that we are getting to a grip on the situation, so progress is being made around our sufficiency. I think highlighting some of the key achievements. At section 3.10, we are looking to create our own in-house residential provision, and that was brought to Cabinet in February, and we're hoping to bring a further business case to Cabinet in July around creating a children's home in Swindon. We're increasing the number of in-house foster carers. We have developed a whole commissioning team within Council Children's Commissioning Team, and we're developing the market around the providers. We've reduced, I think it's interesting, we've reduced the number of placement breakdowns from a high of 11 in June 24 down to 4 in this March. We are actively involving children in their voice around commissioning contracts, so they're involved in that. And we've got some quite innovative developments around accompanied asylum-seeking children into HMO and supported accommodation. However, there are challenges as they're listed on section 3.11, and section 3.12 goes on to highlight some of the actions that we're going to take in 25-26 to address some of those challenges. So I think I'll leave it there and open up for questions and then answer any of the detail.
Thank you very much for your introduction. So I'm going to open the debate and I'm going to start taking questions. Councillor Davies.
I'd have to go first. You said the 25-26 action plan was attached.
It is. That's an appendix. No, sorry, 24-25. The action plan for the current year is attached, but if you look at 312,
Yeah.
that highlights that from 312, 312.1 through to 360 highlights the actions that we're going to take in 25-26. It's continuation there.
And so is there an action plan? Like, is there an action plan that looks like the 24-25 one? Does that exist for 25-26?
Yes.
Yeah, absolutely. Yeah.
Thank you. Any other questions? Councillor Perry?
Thank you, Chair. 3.10.4, the 40% of children, do you know what number that equates to? Living more than 20 miles away.
I was trying to see if I could work it out, but my maths isn't that quick or that good. There are, as of this week, about 308 children that are currently in our care, so 40% of that.
And could I make a request, Chair? And this is a request that I've made for years. And it's been a little bit, sometimes we get a percentage, sometimes we get a figure, sometimes we get both. Could we have both all of the time so we have a clear understanding of what that all looks like? Thank you.
Yeah, that's a fair request.
Thank you. And do we know how many children and people are currently homeless in Swindon, and of that number, how many are care experienced?
I haven't got that detail to hand, but I can certainly find out. Just on the previous question, though, I think it's important to clarify that of that 40% that do live outside of the borough, some of those will be for very specific reasons, and we have now got to a point of being able to break down that figure. So, if you discount those that are living with family members or those that are placed out of the area because of risk, or those that have been permanently matched with their carers, so you don't. If you discount them, 85% of the remaining children live within the 20-mile range. Perhaps the data shows.
Would it be possible to have the breakdown?
We can break that, absolutely.
Thank you.
We will note it down as an action.
Thank you.
Any other question, Councillor Cook?
Could you tell me how many foster carers you've recruited?
Yes, I think of the net total is 15 of the year, and that's the target we have for the next 3 years. Sorry. Yeah, so of the current year, it's 15, and then the following 3 years we have targets of 15 for each subsequent year.
Okay, thank you.
Thank you. I'm going to ask a question. I think it was back in 2023, there was change in national regulation when there was a requirement for all providers of children's accommodation to be properly registered and then regulated by Ofsted. Has there been any impact on this in Swindon? Because at the time, the concerns that the provider would close down.
No, in fact, there's still new provision opening all the time. So it was previously sort of split. So you had the residential provision that provides care that was inspected by us, and then the change in the regulation requires support and accommodation providers, so those that provide support rather than care, to also be registered. It is a registration in a different way, and it's a different inspection regime. I think nationally, not all of those homes have been inspected by Ofsted yet, so they're registered, that are waiting for inspection. So we haven't seen an impact on that. Sometimes we're approached by providers to say that they're opening accommodation within the area to us if we're interested in working.
Do you get updated by Ofsted of the ones they inspect and the outcome of the inspection?
So we would be notified if the placement receives an inadequate rating from Ofsted so that we can respond in relation to whether children.
And I suspect if any of these types of accommodation were inadequate, then there would be actions in place.
So Ofsted will generally generate, the inspection result will generate a plan for the home in order to rectify the issues. If we've got children placed in that home, then we may take a decision to move that child to a different placement, or we may take a decision to put an action plan in place with that home in what we would expect to see them achieving if we're just going to continue.
And do you have roughly an idea where the providers are? Because if this happens, for example, let's say children need to move out from one accommodation to different one, then there would be additional demand.
So that against
So if do you have understanding where the providers are at, like roughly, in terms of quality of the service? If there is a risk of any of them being scored inadequately, which would then impact council because there would be additional demand.
I think we have our own sort of checks and balances that we use with providers, and they also residential care providers by regulation have to have an independent, or have to have somebody independent that goes in and provides a report on a monthly basis. So we keep track of where we think providers are at, and generally have a good relationship with providers. Sometimes providers will have more than one home, so if one home's gone, if you've got an medical basis, you may go enter into a conversation with them about using another one of their homes that isn't medical to support that person.
Thank you. So there's no risk of that kind of.
No.
Okay, good. Thank you. Councillor Perry?
Thank you, Chair. You almost partially answered this question, but I was going to ask you, do we inspect young people's supported housing accommodation? And if so, what powers do we have to force improvements to the quality of living standards in our?
So they would be inspected as part of the Ofsted inspection regime. Our commissioning team will visit providers and sort of undertake a check on our behalf. I mean, we've got no powers to enforce improvements on them, but ultimately, if we're not satisfied with the level of care that they're providing, we would instigate an action plan with them, and if they fail to meet those action plans, obviously we take the decision to move the child and university somewhere.
I won't name it, but there is one provision I'm thinking of in particular in Old Town that has had a pretty bad reputation for years in terms of the quality standards of the living accommodation. So is there any action that could be taken against any such places? And if not, why not?
It would depend if they're a registered provision. So is it a provision that looks after children in care?
It's young people who present as homeless, I believe.
I'd have to look into it.
Maybe I'll take that point, Chair. Thank you.
I mean, this sounds like it might be raised as an individual case.
Well, it may not just be the one provision. That's why I was asking more generally, but yeah.
Yeah, we can take it.
Okay, thank you.
Any other questions, Councillor Cook?
Yes, in 3.10, you're delivering high quality homes for separated migrant children. Can you tell me what age group these children are?
And so we generally, the age group for separated migrant children that are normally 16 when they come into the service generally. There will be some that are younger, but a more proportion coming at the age of 16. And they're then supported through into adulthood by a social worker, and then entitled to a leaving care entitlement. So we have a personal advisor from the Positive Futures team after the age of 18, up to the age of 21, or up to the age of 25.
So do they have 24-hour supported care in this accommodation?
It would depend which age bracket they fall into. So if they're children, they'll continue to have support. If they're in supported accommodation, they'll have a number of supported hours that is allotted to them depending on their level of need. We continue to provide accommodation for some separated migrant children post-18 because they haven't status. So if they've still got an application in the status, then we continue to provide support because they can't claim benefits. And so the level of support for those we do.
And do you mix the different nationalities in there, or
we try to match?
We try to keep.
Yeah, we try to match because it's better for them. Yeah, it feels more comfortable. And it's just more supportive.
Okay, thank you.
Thank you. Any other questions? No, it sounds like we can close the meeting. So Thank you very much.
Thank you.
And we can move to the next item, which is the prioritization exercise of items relating to adult social care and public health for the next municipal year. So we received items for public health, where there's only 5 items, so we are taking those and they're going to be scheduled in forward plan. For adult social care, we received a number of items. So what we decided to do for the committee members to vote. So each of you should have a paper where you can mark 6 items that you would like to discuss. So if you could complete the sheet. Yeah, we're being very democratic.
You're not using the non-vote.
And I would like to just as a big the annual review of performance is actually an item. But I'll give you a couple of minutes to complete the sheet.
I
wasn't assuming. Let's go. Yeah, I wonder if I might get a bit of clarity on this.
Yeah, of course.
We'll make a recommendation based on those 6. I presume we'll still have an opportunity in the new year to still add items if we feel it's necessary.
Of course, this will form the.
Appreciate the press has left now, but I wouldn't want it to be interpreted that we've just had
So
8 presented to us and 6 we've chosen.
Yeah. So this will form a baseline, and then like you saw today, when we have follow-up items, then we can always pencil in, or if something comes up that is urgent or of high significance to the public, we can always adjust and move things around. And so there is always a level of flexibility.
No pressure, but we do have the chief returning officer in the room.
What, the chief returning officer?
I'm here because I feel like I've never been to this committee before. I've been here.
All stopped writing, so they must have filtered them by now. Debates are in.
Do we need polling agents?
This is this one was very.
So please, it was supposed to be, these will take time. So what's? Six, yes. Ah, of course it's that one. I think that is actually like, so. So that's. Really good things to just do in one person. We will see how I do this one. Yeah. You basically just.
Right, so we have the outcome of the vote. Thank you very much. So based on the voting, the item that we can take off its annual review performance, because that one only received 4 votes. And we also need to deduct one more, but we have 3 which received 5 votes, which is people involvement CQC regulation and innovation and best practice. The rest of them going forward is these 3 ones where with the least number of votes. Because we have a tie in this one, so I would just say that chair and the vice chair will use our prerogative right and we decide which one will be excluded.
If democracy doesn't work.
So, sorry, which one have you already taken off? Sorry.
So we definitely taken off annual review of performance. That one we go through, and then we'll need to make a decision between people involvement, CQC regulation, innovation, and best practice. So then me and the vice chair just need to make a decision. There any objections?
I would have kept the annual review.
Yeah, but just, we should review that in some.
It says it's going to scrutiny anyway, doesn't it? Is it not going to scrutiny as it did before?
So maybe what we could do, maybe we could do annual review as a which we just read and then, yeah, Claire?
Yeah, just to be clear, when it says it's went to scrutiny in July, it was this scrutiny. Yeah. So it's a whole pack that gives you the performance of the service across the whole year.
Yeah, so there was the.
Yes. I would have voted differently.
Yeah, sorry.
It's the problem with democracy.
So I'm sure we can figure out something out. Thank you. It's too late to change the vote.
I want
It's difficult because there are only as many meetings as we have, but I'm sure we can work around it and maybe take some items as read and just ask questions. Maybe
And there are a couple of those items that are tied that could easily be merged into one report.
So I'm sure we can work around it. Councillor Perry?
Yeah, just on that point, Chair, you did acknowledge some time ago that you were in agreement with some of us that it was too much having adults and children in one committee to give adequate scrutiny that both deserved. However, going forward, I understand there's no change. Why is that?
Well, I keep raising this, and in my opinion, the remit is too large. So this been raised the leader with the cabinet members, so they're all aware. And it's my understanding at this point is that there's no change to the committee, really, unfortunately.
So they haven't listened to the chair of this committee, which is, in my opinion, it's shameful.
Well, at the moment, it is what it is. Councillor Bowman?
I think one of the reasons the committee hasn't been split is there's not enough capacity in the clerks at the moment to split the two. And I think that's the reason. But why I wanted to ask a question, the annual review performance will be looked at by CQC, and they would expect it to have come to scrutiny. So,
thank you. Yeah. So then maybe you can join annual performance review. We will be talking with the CQC because I'm sure we need to cover the outcome of the CQC. So, I'm sure there are ways we can work around it. It's just very difficult because now we're going to add all the public health items, and also we have children's services where we need to focus our attention. So it's very difficult to cover all the items. So I'll continue raising it with the hope that something will be done maybe in the next municipal year. So are there any other questions on this item? No. Thank you very much, and thank you very much for taking part in this exercise. I mean, it was a first trial to see how things go, so we can always improve for the next time. And the last item, we have status of requests and actions. Are there any questions about item 10? No. Thank you very much. So then that was the last item, and I'm very happy to close this meeting. And again, I would like to thank you from the bottom of my heart for all your hard work, to the committee members, to cabinet members, and to officers. I think it was great. I really enjoyed being part of this committee, with such great personalities, and sharing your experience and insights. You all done very well, so thank you for that.
Thank you, Chair.
Can I just say, Chair, that I would like to thank you for being an excellent chair this year. It's been an absolute pleasure to work with you on this committee. Thank you, and keep pushing for what is right. Thank you.
And I'd like